All right. Thanks, Chris, and thanks, Jen, and obviously Matt and Kara. So, for context, my name's Kyle Hillman. I am in Charlotte, North Carolina. Dad to Rowan. Rowan is 8 years old, who will be 9 in 10 days. Can't believe it. So, we got our diagnosis in January of 2020. Um, for those of you in the room, I'm sorry I'm not standing there with you. It's this was a mess, but I just couldn't be there this year. But for you watching from home, the parents at the kitchen table, the grandparent who wants to understand what's happening with their grandchild, the aunt, the uncle who just wants to learn, the family in Australia dialing in at some ridiculous hour of the night, you and I are in exactly the same place this morning, and I'm glad to be here with you. I want to start with something that I can actually show you. Years ago, Rowan's teacher, our friends, physicians, and others asked me, what is Skraban-Deardorff syndrome? And I didn't have an answer. I didn't have a good answer. I didn't really have an answer at all. What I had was a printout of a journal article that I didn't fully understand myself, and they couldn't get through it either. I'd hand it over and I'd watch it land nowhere. And I was thinking, my son has a condition that I can't explain to the people who are with him every single day. What we did is we put the first brochure into somebody's hands less than a year ago today. We distributed 1,450 of these brochures last year into 9 countries. We've translated them into 5 languages with more coming. And families are handing them to teachers, to therapists, to physicians, to grandparents, to neighbors, to anybody. That number is actually out of date. That's from our annual report this year, or I'm sorry, as of talking, we're up to 1,806. 1 year, 1,800 brochures. And what that tells me is just how much this community needed a way to explain itself. We went from, I can't explain this, to here. This explains everything. So here's what I want to cover this morning from the foundation side. How we got here, where we stand today, and where we're hoping to go next. And guess what? I'm going to spoil the ending because the answer to all 3 turns out to be the same. It's not money, it's not me, but it's the people watching this and you in that room. Let me show you what I mean. I want to take you back further than you might expect, further back than the foundation, even further back than my involvement. And that's June 23rd, 2017. An email went out to the WDR26 families from the team at CHOP. And the news in it was that Dr. Skraban and Dr. Deardorff's paper had been accepted by the American Journal of Human Genetics and would publish in early July. And that's the paper that gave this condition its name. Before it, our kids had a list of symptoms, but after it, they had a diagnosis. But that's not the part I want to read to you. Some of you may recall this line, quote, "We could not have done any of this without the support and participation from you. We are all truly grateful. With that being said, we thought it might be nice to have another gathering to extend our gratitude." And then, no date, no venue, just if you'd like to come, send me the dates that work for you, and we'll try to build it around you. That email is where this family meeting began, 9 years before this one. And I want you to sit with exactly what it says. The paper wasn't out yet. Our kid's condition didn't have a name yet. And the first instinct of the doctors and the researchers wasn't to publish it and move on to the next thing. It was, let's get these families in a room and thank them. And that instinct is the reason you are all here together this week. The gathering that grew out of it was small, 7 or 8 kids, 20 people maybe all together. There were more of us out there, but we just hadn't found each other yet. Plenty of families simply couldn't get there. But 20 of you made it into a room. And when it ended, people stood around and traded email addresses. That was the infrastructure. A Facebook group, a handful email addresses written down before everybody flew home or drove home. But something had started. Two of the people in that very room right now, Sherry and Jen, you ladies went to Katie Grand afterwards and asked a pretty simple question. For the next one, could we help? Could they do something so the parents could actually find each other? The doctors brought us together, but the families decided to keep it going. That's the founding act of this organization. It's not a board, it's not a grant, it's not a strategic plan. It's two moms that simply asked if they could help. In November of 2021, a small group of parents and clinicians got together on a Zoom call, and the idea of an actual nonprofit was born. Over the next several months, that group taught itself how to build corporation, bylaws, board structure, filings. Nobody really did this for a living, but we just kept showing up. July of 22, Pennsylvania approved us. And that same month, we gathered at CHOP and we announced that we were going to build a foundation. And 2 weeks later, the IRS termination letter come. We were official. Fast forward by 2024, this same meeting had 213 attendees, 108 in that very room that you're at today, and 105 attended virtually from 17 countries. And I want to say something to two people sitting in the room right now. Sherry and Jen, you are the ones who asked if you could help. Sherry, you're our treasurer. You count every single dollar that this community raises, and let's be honest, so much more. And Jen, our family programs chair, you plan the meeting that all of you are sitting in this morning and attending virtually. 9 years ago, Katie sent that email asking families what dates would work, and this year, Jen, you're the one who sent it. That's the story of this foundation, folks. It's never been any more complicated than somebody deciding to help. So that's how we got here. I'm going to tell you where we stand, and I want to give you some real numbers. In our first year, 2022, we raised about $46,000. Last year, $167,000. 3 straight years of growth, each one up 40% or more. And it happened because families went out and raised it themselves. A golf tournament, a night behind the bar at a tap house, personal fundraising pages, people just asking. That's the money. But there's another number from last year, and it won't show up on any bank statement. It's last year, volunteers gave this foundation 945 hours. Governance, committee work, event planning, advocacy and outreach, and the unglamorous administrative work that keeps this organization legally alive. I want to be precise about what that number means, because sometimes people assume that there's a machine behind us. There's not. There's no machine. SKDEAS has no paid staff, not one person. No salaries, no benefits, and no office. And last year, 3 cents of every dollar that we spent went to administration. That's it. That's unheard of. What this foundation is a couple dozen people's evenings and weekends and early mornings. That's it. That's the operation. And it's still growing. Families are now registered with us in 27 countries, up 5 from the year before. Our online community is approaching 500 people around the world. But numbers only matter if they turn into something. So here's what came of it. Matt talked about it, the science. We funded work at Transcriptobio, screening compounds to see if any of them could raise WDR26 protein levels in our kids' cells. Some of them did. But I want to be careful. I'm a dad first. I'm not a scientist. And I'm not going to stay on the screen and tell you something's coming, because I don't know that. But what I can tell you is that this work is real and it's underway. 28 families in our community are also taking part in Dr. Tom Frazier's neurodevelopmental assessment study. At-home assessments that build a clearer picture of how Skraban-Deardorff syndrome presents and how it changes as our kids get older. This one's not costing us $1, but it's costing 28 families nothing more than their time. And none of this is only us either. Okay, our partners at Soros and Vincibla in Italy raised 50,000 euros and put that straight into WDR26 research at the University of Genoa. The work doesn't stop at borders, and neither does this community. Secondly, getting our kids recognized. Late last year, we filed a formal application for a dedicated ICD-10 diagnosis code for WDR26 related neurodevelopmental disorder. It sounds like paperwork, but it's not. Right now in the US healthcare system, our children are essentially invisible. There's no box to check and no clean way to code the diagnosis, which means no reliable way to count us, no consistent medical record, and one more fight with the insurance company every single time, or a piggyback diagnosis code. But what this code will do is it's going to change that. It means we can be counted. It means researchers that Matt talked about can find us. We built that application alongside the clinicians, the researchers, and the geneticists who've been dealing with this community since the very beginning. And it carried the lived experience of the families watching right now. It wasn't approved. But we weren't alone in that. A number of applicants this cycle weren't approved. So we're back to the drawing board. And I have to be clear, it was a serious piece of work, and a lot of people gave a lot of themselves to it. And I want you to hear me say that it mattered and none of it was wasted. Because here's what we have that we didn't have a year ago. We have an application written, filed, and taken seriously. We have the clinicians and the researchers who built it with us and who are ready to build the next one. And we have a community that can and will be counted. We got on the door, but we didn't get through it yet. So let me be as clear as I can be. We're not done. We are nowhere close to done. We're going to strengthen that application. We're going to file it again, and then we'll file it again after that if we have to. Our kids are going to get a number. It's not the only door we've been knocking on. On May 24th of 2025, the World Health Assembly adopted a resolution making rare disease a global health priority. We were more than one of 200 organizations that backed it. Emily Gerst represented us at NORD's Living Rare Conference, and Cynthia Lang and I sat in on an international working session on how patient registries get built. Third goes back to you. Nothing I said matters if it doesn't reach the families that it's designed for. So I want to recap 2025 briefly. We ran 4 educational series last year. AAC devices and communication, a parent panel for the newly diagnosed, schooling and IEPs, and estate planning for special needs families. We built the brochure I showed you, and we built and designed a coloring and activity book. And as of last night, I just found out, Randy, there is a book about Violet. So I want to tell you about these pieces. There's a family in our community that has a son with SKDEAS and a younger daughter, a sister. For years, this family's been trying to find a way that explains what's going on with her brother, what it means, why he's different, why the house works the way it does. Years, nothing worked. The message wasn't received. Then they sat down with this coloring book, and she got it. She asked questions. She laughed. And in one afternoon, a coloring book did what those parents have been trying to do since she was old enough to ask. That's what your donations do. Some of it by science, and some of it buys a little girl finally understanding her brother. Let me tell you what I actually think about because it's not money. When the day comes, when the right research needs hundreds of thousands of dollars, I'm not worried about that. This community has raised more every single year that it's existed, from a golf course, from behind a bar, from personal fundraising pages, just from the ask. If we need it, we're going to get it. I've watched you do it. I've watched us do it. What we need more of is people. 945 hours is a remarkable number. It's also, right now, roughly the limit of what this group can do. Every idea we have, more education sessions, more translations, more gathering in places where people can't travel to Philadelphia, every one of them comes back to the same thing. We need more hands. Where we're going, 2026 is halfway over, but we're going back for the code. It's the first thing on the list. We're going to take what we learned. We're going to make the application stronger. We're going to get to the next cycle. It's not a one-attempt fight, and we never thought it would be. We fund smarter science. You heard the recap from Matt this morning. Dr. Paul Carney, Dr. Jonathan Weil. Our medical advisory board continues to get strengthened. Jonathan leads discovery research in neurodevelopmental disease. He now sits at our table when we decide what's worth funding. When a researcher comes to us, someone in the room can tell the difference between worth it and worth it won't. For a foundation our size, saying no is just as important as saying yes. For 2026, we go global. 27 countries. A mom in Australia told us she would love to come to a gathering like this, but simply can't afford to fly across the world for it. And that's not a complaint to absorb quietly. That's a to-do item. And frankly, I'm on a screen this morning, and so are a lot of you. It's working, and it's worth noticing. We build the permanent things, the registry, the trademarks, the brochure in more languages, the welcome program, so that when a family gets this diagnosis, somebody's already there waiting for them. And we do all of this the same way we've done everything, with people who have day jobs and kids and no free time, but decided to help anyway. I want to end where I started. 8 or 9 years ago, 20 of us sat in a room and traded email addresses on the way out the door, because that's the only way we knew how to find each other. Today, we fund research on 2 continents. We filed to give our children a name in the medical record. There are families in 27 countries who know they're not alone because somebody watching decided to make sure of it. Nobody's a professional at this. Nobody has extra time. But that's what makes it remarkable. Not one of those 945 hours was easy to give. We went from, I can't explain this, to here. This explains it. Now, I can't tell you what the next 8 years hold. I'm not going to stand here or sit here rather, and promise something that I don't know. But I can tell you exactly how we're going to get there, because it's how we've gotten everywhere so far. Somebody in this community, somebody watching, somebody in that room is going to ask, can I help? So I want to say thank you. I want to say thank you for your money. I want to say thank you for your hours. I want to say thank you for your kids. But most importantly, I want to say thank you for showing up, whether it's in this room or on the screen. And then the last thing, and I'm going to get out of the way here. Everything I've described in the past several minutes has been done by people that have no more free time than you or I. And if any of it made you think, I could probably help with that, come back at 1:15. We're going to do a session about exactly that. No commitment, no sign-up sheet. No, we're not going to. Just come. Just come. And if you're on screen, come back. That session's for you too. I'm going to be on the same screen, so I hope to see you after lunch. With that, I say thank you. I'm going to give it back to the room.